Air bronchograms are a fascinating and important radiological sign that can provide critical insights into lung pathology. So, what exactly is an air bronchogram? Imagine a healthy lung where the air-filled bronchi are clearly visible against the surrounding lung tissue. In a normal scenario, the lung appears light pink, and the airways are easily distinguishable. However, when there's an underlying condition, such as pneumonia or pulmonary edema, the lung tissue becomes denser, often appearing gray or white. This contrast allows the air-filled bronchi to stand out, creating what we call an air bronchogram. Now, let's dive into the causes of air bronchograms. A helpful mnemonic to remember these causes is PAPR. P stands for pneumonia, where the infection leads to consolidation of lung tissue. A is for atelectasis, which is the collapse of part of the lung. P is for pulmonary edema, where fluid accumulates in the lung tissue. It represents embolism, specifically pulmonary embolism, which can cause localized areas of infarction. Finally, R stands for respiratory distress syndrome, often seen in premature infants. Each of these conditions can manifest differently on imaging, but they all share the common feature of air bronchograms. Identifying air bronchograms on imaging is crucial for accurate diagnosis. When we look at X-rays or CT scans, we can see these air-filled bronchi highlighted against the opacified lung tissue. This visual cue is essential for radiologists and clinicians alike, as it helps them differentiate between various lung conditions. For instance, in pneumonia, the air bronchograms are often well-defined, while in other conditions, they may be less pronounced or absent. Speaking of absence, it's also important to understand when air bronchograms are not present. In some cases of lung consolidation, such as in certain types of pneumonia or in cases of complete atelectasis, the absence of air bronchograms can be just as telling. This differential diagnostic importance can guide clinicians in determining the underlying cause of patients' symptoms and tailoring the appropriate treatment. In summary, air bronchograms are not just a radiological curiosity. They're a key sign that can help us understand and diagnose various lung conditions. Remembering the causes with the PAPR mnemonic can make it easier to recall these important concepts. The presence or absence of air bronchograms can significantly influence clinical decisions, making it essential knowledge for anyone in the medical field.